Hi, my name is Dr. Scott Boles. I'm a clinical psychologist and psychoanalyst in private practice, and an instructor at the San Diego Psychoanalytic Center. I teach in the Psychotherapy Program, both the child and adult training programs in psychoanalysis, and facilitate a monthly Psychotherapy Study Group. If you're watching this video, it's quite possible that you're looking into potential training opportunities at the Psychoanalytic Center. If that's the case, I'd certainly like to encourage you to do so, given my positive experience with it. My story is as such. I earned my doctorate back in 1996, got licensed shortly thereafter, and quickly began pursuing my goal of developing a full-time private practice. It wasn't far into that experience, however, that I came to realize I still had a lot to learn about doing really good therapy. It wasn't that my graduate education was lousy. In fact, it effectively taught me how to reduce my patients' symptoms, guide them out of crisis, and teach them a variety of tools for coping more effectively in their lives. Yet, I often found myself, along with many of my patients, wanting more than just symptomatic relief and a largely intellectualized understanding of their problems that often didn't translate into more permanent and lasting change. It seemed that what patients really wanted, when provided with a safe therapeutic space to do so, was to know themselves more fully, in ways that allowed them to love themselves and others more deeply, to find greater satisfaction in their work, and to create more opportunities for enjoyment in their lives. Fortunately, early on in my career, I came to appreciate that these types of goals tended to have the best opportunity to be met in an insight-oriented, experiential-based approach to treatment, like psychoanalytic psychotherapy or psychoanalysis. It was this understanding that led me to pursue psychoanalytic training. My first experience was in the psychotherapy program, and it proved to be a great fit for me at the time, given I was still developing my practice and trying to figure out how to make it all work. I'd certainly considered the psychoanalytic training program, but thought that maybe it was a little bit more than I could manage at that point. My decision to do the psychotherapy program proved to be a good one. I credit it with providing me with a solid foundation and working dynamically with patients, especially teaching me how to enliven and deepen the process of therapy that led to more meaningful changes for my patients. After graduating from the psychotherapy program, and given my growing enthusiasm for working analytically, I decided to take my studies a step further. I applied and was accepted to the child and adult training programs in psychoanalysis. It proved to be an invaluable experience for me, one that changed both my personal and professional life in so many meaningful and lasting ways. It's not to say that it wasn't without its challenges, yet when I look back on it all, I realize that my investment has more than paid itself back. In fact, I profited, I think, in two significant ways. First, it's helped me come to see each patient as a unique individual with their own personal narrative. How no two people are alike, and how everyone yearns to be listened to and understood. And when someone is given the space and the necessary time to tell their story and to be helped in understanding themselves better, great things can happen. It's this approach that keeps me excited about going into work each day. The second way in which I profited from my analytic experience is that I was able to become a part of a greater community. It's allowed me to make many friends and colleagues over the years through my various studies and teachings, and in a field as emotionally challenging and demanding as the mental health field, it's nice to have a place to hang one's hat, like the Psychoanalytic Center. So, with that said, that's my story. I hope that you'll consider joining us and create your own.